joining us now on the show is going to be Prisca Onwenu. She is a nurse over at the Henry Ford Health System. She was one of their first nurses to get the vaccine. She also works in the ICU. Thank you so much for being with us on the MegaCast.
Thank you, Ronnie, for inviting me.
But I will say too, before we get into the vaccine, how are you holding up as a nurse, someone who is on the front lines trying to manage this virus?
It's it's been real difficult. I think with this pandemic, I want to say that in my whole entire career as a nurse, this has been the most difficult time. Even working with cancer patients, working in the ICU, you see the worst of the worst. But this pandemic has really just taken that out of the ballpark.
I just watched a documentary over the weekend about the Ebola crisis that happened in Sierra Leone back in 2014, and they did cover some of the healthcare workers that were on the front line. And just mentally, and the sacrifice that you and your coworkers are making each and every day, can we just say thank you? And I know thank you, those could sound like empty words at some point in time, but your effort each and every day is appreciated. And I would imagine from the families as well. Can you talk about your interaction with some of the family members of some of the patients that you've had to treat during this time?
So I think for most of our families, it's been really difficult just not being able to be with their loved ones during their last times. Um, and just thankfully, we were able to do the iPad where we could communicate with the family and where they can visually see their family members. But sometimes our patients in the ICU are on the vent, they can't talk. So it's pretty much they can see them, but that where you come in and touch your family member and hold their hands, and they see you, they can look at you, that's missing. So we've had to really support our families too, not just the patients when their loved ones are going through this difficult time.
With that, you've been on the front lines. Before the vaccine was available, how concerned were you each and every day that you went home after leaving your job?
Very. I'm a mother of 6 kids. So every one of my sons is asthmatic. So every day, when the pandemic first started, first of all, I had to move to the basement because I was afraid I was going to give it to my family members, and not really knowing what we were facing and not having a lot of information on the virus. I was really scared. So, and I just felt like I wasn't willing to sacrifice my family over it. So I had to move to the basement. I could not have my kids, I couldn't even be in the same room with them to check their schoolwork. I would just stand at their door and, talk to them or call them on the phone. But I have a walkout basement. I went in and out of my house from the walkout basement. So I didn't have to be in too much contact with them.
So the personal sacrifice is great. You were one of the first to get the vaccine.
Yes,
Why?
thank God. Why? Why not? So many reasons. Where do I even start? Um, like I said, I watched so many people die from this virus. You know, I, the worst thing was having these patients come to me. Most times they're not on the vent yet, so they can talk, and they hold your hands and beg you, I don't want to die. They tell you so many things they have to live for. And at the end of the day, you watch them lose their lives. So that in itself was enough trauma, just seeing all those patients that beg you. I remember so many of them, I still see their faces in my head where they beg me and say, please, I don't want to die. At the end of the day, they end up dying. Um, and even the ones that survive, the after effects of the virus and the things that they have to go through, the ones that have blood clots, stroke, so many other different things, I could not wait for this vaccine to come out. Um, because I'm just thinking, even first of all, starting with my family. Every day I come to work and walk in a coronavirus patient room, I'm afraid I might catch it and take it home. So just from that perspective, knowing that if I have this, I decrease my chances of getting it and taking it home to my family and my family members spreading it to other people, that's one. Then for my patients that died that begged me, just knowing that they didn't have the choice of this vaccine, whether they could take it or not. And I have that choice. There was no way I was not going to take the vaccine. And then secondly, I have a lot of people, both in my I'm Nigerian, in my Nigerian community and outside my Nigerian community that do not have faith in this vaccine. I felt as a healthcare worker and as a frontline worker, if I can take the vaccine and show them that I was willing to take it and nothing happened to me, that it will impress upon them the importance of taking the vaccine.
So you're standing up not only to give you a sense of peace for your family, but also is a symbol to other people that are on the edge, that are worried about the possibility of getting this vaccine.
Definitely.
Do you think the general public, if they walked in your shoes for even one day and they saw firsthand what the virus did, that there would be any hesitancy amongst them to get the vaccine?
I had, just on social media, when I see people argue about how the virus is a host, how it's not as bad as, you know, people say it is, when I see people politicize it, I just wish sometimes that we could just have them come in just for even a few hours out of the day and just watch what these patients go through and how rapidly patients decline from being okay, you know, talking to you like and in 30 minutes they're on life support. We have them on so many vasopressors. They're struggling for their life. I always felt like if all these people that don't believe in the validity of this virus could come in for a few hours and see it, there'll be no question in their mind how serious this virus is.
Prisca Onwenu, she is a nurse over at the Henry Ford Health System. She works in the ICU unit, and she was also one of the first members there at the Henry Ford Health System to receive the vaccine. Of course, the state of Michigan is moving into the new phase of the vaccine distribution starting today. Members of the general public are starting to be able to get the vaccine. Do you think this vaccine is going to be our way out of this pandemic?
I'm hoping that this vaccine gives us hope. I hope that everybody can make the choice if they can to get this vaccine. That way we can somewhat get back to a normal life, and stop the spread. Mostly it's the spread. Because when, you can have the virus and be asymptomatic and not know it, but you don't know the person that you pass it to, how it's going to affect them. And that's my biggest fear, even with just working. It's, the more people that can get this vaccine, there's hope for us to return to normalcy, or at least a new normal.
I'm sure that you're waiting for those days on the front line as well, because I'm just thinking about the emotional toll that this must have taken on you and other members of your team to live this each and every day. Were there days where you were just like, I can't do it?
I'll tell you that after the first wave, and when everybody started talking about the second wave, I just kept saying, I can't go through this again. I can't do this. I told myself every day, I can't do this again. This is too emotionally taxing on me. But, the first patient trickles in, the second patient, and next thing you know, you're doing what you said you can't do. Thank God we have really good support at the hospital. Our president is readily available to talk. We have wonderful support services here that if you needed to talk to somebody, you always had somebody to talk to.
Prisca, you mentioned that you're a mother of 6. How old are your kids?
Anywhere from 11 to 24.
So there's a big gap there. So in between this, some of them are also having to remote learn. What's that been like for you?
Really tough, especially during the first wave, just because I couldn't monitor what my kids were doing. And I'll tell you, their grades did drop because I have a 15-year-old boy, half the time he wants to play PS4. And so with me now hovering over him and and even checking his homework, yes, his grades did drop, but we're working on it. He got a few things taken away, especially the PS4, so he can rethink his actions.
So I will say, you know what? These kids are lucky. Back in our day, you had like one telephone and it was the dial,
I
you
wish we
know,
can go back to that.
right? And the cord, you would stretch it all the way upstairs. But some good news for you as a parent. I mean, like we've had Oakland University on, and they do offer a lot of scholarships to kids that play these video games. So they can make a lot of money and they can get college scholarships. So maybe if you hold that over his head, if he gets his good grades, it can kind of, balance that conversation.
I think just taking away his PS4 is making him rethink a lot of his actions. I also have his phone until his exams are over and I see his grades. So that's helping.
Oh my gosh, that's like death to a 15-year-old boy.
I know so. He keep asking his friends to test me and beg me to get his phone back.
With that though, what do you think is going to be the positive that's going to come out of this pandemic for you and other healthcare workers on the front line?
Um, I think the positive is, for me, I feel like we've seen the worst and it's made better nurses out of us. Um, for me personally, I think I'm a little bit more compassionate and more understanding having gone through this pandemic and just thinking about what the families are going through. uh, that too has helped me realize, it's not just the patients that we need to take care of, that we need to take care of the families.
It's been such an emotional roller coaster for the entire country, but also for people such as yourself. With the vaccine, you've had no side effects.
So with the first vaccine, no side effects with the first dose. With the second one, I had a little soreness and a little heaviness with the arm, but I went to work the very next day after the vaccine. And then I had a little lingering headache, just a nagging headache. But all of that is gone now. So I'll do that all over again if it just gives us hope. Yeah.
Right. And are there any members of your family that are eligible to take the vaccine as well?
So far, no.
So it's just you, but for you, it's peace of mind.
It's peace of mind for me for sure. And even
Well,
for my families, um, because every day I leave the house, of course, they're very worried.
yeah, is this a day? And we've heard the heartbreaking stories of first responders and people on the front lines that have gotten the virus from trying to save others and have not lived through the other side to be able to see this vaccine. So that has to
And
be a very, somber and sobering impact for members such as yourself and others that are working each and every day.
yeah, and it's particularly difficult when our kids see these things and worry about you. And, even just the slightest headache makes my kids worry, like, Mom, are you okay? I get several tests. Like, are you okay? Do you have corona? My 11-year-old will typically ask me, do you have corona? And I'm like, no, you know. So just that they too are going through this with me every day I go to work.
Well, what are your thoughts on the healthcare system here in the United States throughout this pandemic?
So I come from a third world country. I'm Nigerian. Um, and that's the only thing I have to compare it to. As much as you know, we saw um, how can I put this? The pandemic didn't show a good side of the healthcare system, but when compared to the rest of the world, I would say we're doing phenomenally well. You know, we're doing good. You know, our patients have what they need. I know we couldn't save everybody, but for the most part, we did what we needed to. There was meds available, there was vents, there was a shortage, yes, but the people that needed it most had it.
Well, we are so happy that you are still on the front lines and having people such as you. And I can tell you have a huge heart and you care about the patients that you are assigned to give care to. So we want to say thank you again as well. And we wish you the best and the brightest of the futures as well. And again, thank you for having the courage to not only get the vaccine, but to work on the front lines each and every day, but also to share your message and to encourage others to get the vaccine as well.
Thank you, Ronnie. Thank you so much for inviting me again.